helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek. We have Dr. Jim Becker with us today, representing Cabell Huntington Hospital, talking about a topic that just started to, rise in the news. We've talked about it a little bit here on WSAZ, and it's the rise in hepatitis C in the region.
Yeah.
It sounds like a discouraging thing. Why is this happening? First, what is hepatitis C?
Well, first of all, hepatitis C is a viral infection of the liver. It creates a chronic inflammation of the liver, and it's a very common infection. In fact, it's probably the most common reason why people develop liver failure, maybe progressing to liver cancer. So it's a very serious health problem, but it's been around for at least 30 years that we're aware of. Recently, however, the Huntington community, the county, and our state have come into kind of a lot of public awareness because of the high rates of hepatitis C in our population.
So we are seeing that raise, and is that due to the drug use
It
issue?
is.
Okay.
Yes, it's clearly related to the IV use of drugs in our region generally. Our county is particularly high in that particular risk factor for a lot of the drug-using population.
Talk about the health impacts that come with hepatitis C.
Well, hepatitis C usually is not even a problem for people who contract it initially. So you can be infected with hepatitis C without even being aware that you have anything wrong with you. But it settles in and becomes a chronic inflammatory process for at least 80% of the people. And when it does, that chronic inflammation leads to fibrosis of the liver. The fibrosis of the liver eventually creates cirrhosis, and some of those people will go on and develop liver cancer as a consequence. All of this takes place over decades, 2 or 3 decades of time.
Right, so you said a lot of times you don't realize you even have it, so is that the problem as to why it gets so far?
Exactly, and that's why we can't tell people how much hepatitis C there really is around, because so many people have not been tested and they're not aware of their hepatitis C status. So one thing we're trying to do is direct more people to our health departments and to our primary care doctors to get tested so they know what's going on.
So this really is a problem that goes back a few years because we're only finding out now.
Exactly. Some people actually tell me that they think they have hepatitis C because years ago they were told by somebody that their liver enzymes are elevated. Liver enzymes are a blood test that we might do just to do a quick screen to see if somebody's potentially carrying hepatitis C.
And then what about a treatment or a cure? Do those exist?
Yes, they do. We've actually had treatment for hepatitis C for a long time, but the treatments were very difficult to take, took a long time, and the effectiveness of the treatment was kind of low. About 2011, new classes of medications became available. We now have 4 or 5 medications available that are much more effective, much better tolerated, and patients do have an option now of being treated and potentially cured with a pretty high rate of success.
Would you say that there is sufficient information out there for people to understand it completely and to learn more about it? Because like I said, last week was one of the first times that we started to bring it up in the news.
You actually have a lot of information available, but I would encourage people who are concerned to go to the real authorities on this. Our own health department in our county here is excellent on this. They have special people dedicated to it. The state has a nurse named Sandy Graham, who is the hepatitis C coordinator for the state, and she's a great resource over in Charleston. And then, of course, if you go to the Centers for Disease Control and Prevention website, they have great information for the public about it.
And we did talk about it very quickly. We said that a lot of the rise now is due to the drug epidemic, but talk about all the different ways that you can get hepatitis C.
Well, clearly hepatitis C rates are being driven right now by the sharing of needles.
Okay.
That's the issue. So IV drug use is the main contributor, but you can contract it by any other means that would expose you to the blood of an infected individual. So you see ads on TV sometimes that are public service ads that say, if you have hepatitis C, be sure not to expose your family. Don't allow them access to accidentally use your toothbrush. Be careful about things like piercings that people might do. Sex is a risk factor for it, but not a really high risk factor for spreading the infection of hepatitis C.
All very interesting information. So you really do need to be careful when you're around, when you're even just piercing the ears, sharing the
Right.
earrings, anything like that, sharing the toothbrush. So there are things that you really need to watch out for if you're diagnosed with hepatitis C or if you love someone who is diagnosed with hepatitis C. Dr. Becker will be back with us on First Look at 4.
Okay.
We're going to be talking more about hepatitis C, then what you need to know, what you can learn about it, and how you can prevent it from happening. So thank you for being with us today on Moms Every Day. As always, if you need any more information, just head to our website, WSAZ.com. Click on that Moms Every Day tab and you can rewatch this interview, and don't forget to tune in at 4. Thanks for being here. Have a good day.